sometimes we have an ideal situation. Like, let me give you a case in cosmetic dentistry. I think our doctors that are very involved in cosmetic dentistry would love to do more smile design cases. Smile design cases would be typically an 8 or 10 unit upper anterior porcelain veneer case, 8 or 10 unit upper anterior porcelain veneer case. The average fee nationwide today for a porcelain veneer is about $1,500 as the time you're listening to this. So if we do a 10 unit case, and Aaron, run my math for me, how much does that cost? 10 unit case.
When you say cost, meaning like lab and so forth?
How much does it cost the patient? $1,500 a unit.
Oh, $15,000.
$15,000.
Mm-hmm.
So we present a porcelain veneer case to the patient. And what might a lot of people say? Well, how much does that cost, Doc?
Yeah. And then you give them the answer, and they might say, oh, it's too much, I can't afford it, etc. That could be one of the options.
They might be thinking, I've got some other priorities I need to spend that money on. Right. So if all you're offering is porcelain veneers, then it might result in a lot of all or nothing. And yeah, I would love to do a porcelain veneer case, but many of our clients are involved with the AACD, the American Academy of Cosmetic Dentistry, and it's useful to have a tool belt that has multiple tools on it. For example, let's say the patient, what they want to correct is spaces in their upper arch. They have spaces in their teeth. Then another possible solution would be direct composite veneers, So it's not lab fabricated, it's direct composite veneers. And that can be provided to the patient at a much lower cost. That can be provided, again, you come up with your own fees on that, but a typical fee for that might be, let's say we're going to do 8 units in the upper arch with direct composite veneers. That might be a $3,200 fee. And there's a lot of people that would like to move forward with that treatment if they were a candidate. Not everybody's a candidate for it. It needs to be additive dentistry. It can't be reductive dentistry. It's got to be additive dentistry after spaces. But let's say the condition was they had spaces. So then if the patient says, well, I just don't have a budget for that, you can usually see the color go out of their face when you present the $15,000 fee. And then it's like, oh, I can't do that. Right. But if there was an option, if you had the skills to do direct composite veneers, you might say, you know, Linda, let me share with you another possible option for your clinical case. I presented the lab fabricated veneer case first because that would be ideal. That's what I would like to do for you, and that would be the best. However, let me share with you an alternative. Because the conditions we'd be correcting are spaces, I can actually do direct composite veneers that would also correct that. In fact, I have an electronic photo album here. Let me go through and show you some befores and afters. So imagine you had this electronic photo album, you pull up your iPad and you say, you know, and these could be all close-ups where the patient, you still want to have the patient sign a release allowing you to use their photos. But let's say you can say, here's where we started, here's where we finished, here's where we started, here's where we finished. And Linda's going to quickly see herself in those photos. And what is she going to ask when you stop talking? Well, how much does that cost, Doc? And you say, well, the treatment fee for your case would be $3,200. So now instead of I have to do $15,000 or nothing, they might be able to do a $3,200 case.
Yes.
One of the downsides of direct composite, I'm not a clinician, but I know a bit about it, is they're not going to last as long. And you can present that to the patient because they might say, well, why is there such a big difference? Well, these were lab fabricated and we have much higher costs, you know, in terms of the lab fees. These direct composite veneers don't require a lab fee. I do it all with materials we have in the office. There is some limitations. They're not going to last as long. The patient might ask, you know, how long are the direct composites going to last? And then again, doctor, you'll have to answer that yourself. But one of the ways you might answer that is to say, well, it depends on you, Linda. Depends how well you take care of them. And also depends on how well you do about keeping your appointments in our office, so we can help you take care of them. But I would be thinking in terms of 5 to 6 years for direct composites, and it could be longer. And if this was true, you might say, in fact, we have patients that are in their 10th, 11th year of direct composites that are holding up just fine. If that was true in your practice, don't say that if it's not true. But be thinking in terms of 5 or 6 years. And if you get more than that, think of that as a bonus. And again, answer that however you like. But I would encourage you to answer it in the beginning with it depends on you. So they know they have some responsibility. And now all of a sudden, it could be seen as much more viable for them. What we've noticed in my client base is that patients that do direct composite veneers very often upgrade to lab fabricated porcelain veneers way before the direct composite veneers have increased, have reached their end of life, well before. Why do you think that happens, Darren? Why do you think they upgrade to porcelain veneers way before the direct composites have reached the end of life?
I think they love the results and they want to, it's like a person buying a low-end BMW and then saying, oh, I want the best BMW.
They love the results. People say, Lindy, I love your smile.
Right.
And now she thinks I want a more longer lasting solution.
Right.
You're right. They got to test drive it.
Right.
Now they want more. So I'd like you to think about other areas in your practice where you could offer clinical alternatives that are, less expensive than ideal. And by the way, if you're really skilled at doing direct composite veneers, I could show you some photos side by side of lab fabricated case direct composite, and without magnification, you might not be able to tell the difference. There is a difference in terms of the polish, the way lab fabricated veneers polish up. They do have a more of a sparkle, but for a lay person to look at it, because many times people don't necessarily want ideal, they want better, right? They want better.
Right.
So think about that. Think about that. They want better, not necessarily ideal.